Picture this: a seasoned titan of American politics, 83-year-old Senator Mitch McConnell, collapsing unexpectedly in the grand corridors of the Capitol building. It's not just an ordinary trip. It's a moment that ignites debates about age, health, and the demands of one of the world's most scrutinized jobs. But here's where it gets controversial. What if these stumbles aren't just accidents, but symbols of deeper questions about leadership in an era of relentless political battles? Let's dive into the details of this incident and the string of health challenges that have defined McConnell's later years, breaking it down step by step so everyone can follow along. On a Thursday afternoon, Senator Mitch McConnell was making his way through the Senate hallways to cast his vote on a critical issue: the government shutdown. This refers to a situation where Congress fails to pass funding bills, potentially halting federal operations and affecting millions of Americans' lives, from paychecks for essential workers to the smooth running of services like air traffic control. As he walked, two volunteers from the Sunrise Movement, an environmental advocacy group focused on climate action and social justice, approached him. They inquired about the contentious activities of Immigration and Customs Enforcement, ICE, the agency responsible for enforcing immigration laws, which has faced criticism for its handling of deportations and border policies. McConnell chose not to engage with their question. Instead, he lost his balance and fell to the floor, with his security detail rushing to assist him back up. Undeterred, he pressed on with their help and proceeded to participate in the Senate vote. A spokesperson quickly reassured the media that the Kentucky-born senator was fine, and reports confirmed he cast his ballot that evening. This incident comes at a time when McConnell, the former leader of the Republican Party, announced in February that he won't seek re-election after his term concludes in January 2027. This decision followed a series of health setbacks that have tested his resilience. And this is the part most people miss. These aren't isolated events. McConnell has experienced multiple falls in recent years, each shedding light on his long-term battle with the after-effects of polio. At just 2 years old, he contracted this debilitating disease, which paralyzed part of his left leg and subjected him to bullying as a child. His family faced financial ruin trying to cover the medical costs, but intensive physical rehabilitation eventually enabled him to walk again. Years later, in 2019, he slipped at his home in Kentucky, resulting in a broken shoulder. His communications director explained at the time that he had been treated, released, and was working remotely from Louisville. The challenges escalated in 2023 when he stumbled at a dinner event in Washington, D.C., sustaining a concussion and a fractured rib. As a father of 3, he spent 5 nights in the hospital and underwent physical therapy to aid his recovery. Adding to the worries, he experienced 2 instances of freezing up during press conferences, which his office attributed to lightheadedness and dehydration. In a later interview on CBS's Face the Nation, McConnell assured viewers he had fully recovered and was in excellent health. The Congressional Office of the Attending Physician backed this up, stating he was medically cleared to maintain his schedule, noting that occasional dizziness is a typical part of concussion recovery and can stem from dehydration. Fast forward to December 2024, when another tumble occurred after a Senate GOP lunch in Washington, D.C., causing a sprained wrist and a facial cut. Then, just 3 months later, he fell again while exiting the Capitol. Though his spokesperson once more insisted he was fine, these repeated incidents have drawn sharp criticism from political rivals who argue they signal it's time for him to retire. For instance, Senator Rand Paul has publicly challenged the credibility of the doctor's assurances, calling them not believable in discussions with The Hill following the freezing episodes. Now, this is where opinions fiercely clash. On one hand, McConnell's determination to soldier on, overcoming polio's legacy and continuing to serve, showcases incredible grit and a commitment to duty. But on the other, his opponents contend that these health scares raise valid concerns about his ability to handle the high-pressure environment of the Senate, potentially impacting critical decisions like those on government funding or immigration policy. Is it fair to question a leader's health in the public eye? Or does it unfairly weaponize personal challenges for political gain? Does age automatically mean it's time to step aside, or should experience trump such concerns? We invite you to weigh in. Do you think political figures should be held to different standards on health issues, or is this just part of the partisan fray? Share your thoughts in the comments. Agreement, disagreement, or a fresh perspective. We'd love to hear it.